topic is history of clinical trials. The history of clinical trials, the evolution of clinical research transfers a long and fascinating journey from the history recorded trials of legumes in biblical times to the first randomized control of clinical trials of streptomycin in 1946. The history of clinical trials covers a wide variety of challenges, scientific, ethical, and regulatory. The famous 1747 scurvy trials conducted by James Lind contain most elements of a controlled trial. The UK Medical Research Council MRC trial of patulin for common cold in 1943 was the first double-blind controlled trials. The, the pre-James Lind era 562 BC to 1537. The world's first clinical trial is recorded in the book of Daniel in the Bible. This experiment resembling a clinical trial was not conducted by a medical but by King Nebuchadnezzar, a resourceful military leader. During his rule in Babylon, Nebuchadnezzar ordered his people to eat only meat and drink only wine, a diet he believed would keep them in sound physical condition. But international several young men of royal blood who preferred to eat vegetables objected. The king allowed these rebels to follow diet, legumes and water, but only for 10 days. When Nebuchadnezzar's experiment ended, the vegetarian appeared better nourished than the meat eaters, so the king permitted the legumes lovers to continue their diet. James Lind and scurvy trials. James Lind is considered the public physician to have conducted controlled clinical trials of the modern era. Dr. Lind, 1716 to 1904, whilst working as a surgeon on a ship, was appalled by the high mortality of scurvy amongst the sailors. He planned a comparative trial of the most promising cure for scurvy. His vivid descriptions of the trial covers the essential elements of a controlled trial. Lind described on the 20th of May 1747, I selected 12 patients in the scurvy on board the slavery at the sea. Their cases were as similar as I could have them. Arrival of placebo. It took another century before the emergence of another important milestone in this history of modern clinical trial, the placebo. The word placebo first appears in medical literature in the early 1800s. Hooper's Medical Dictionary of 1811 defined it as an epithet given to any medicine more to please that benefit for the patient. However, it was only in 1863 that United States physician Austin Flint planned the first clinical study comparing a dummy remedy to an active treatment. He treated 13 patients suffering from rheumatism with an herbal extract which was advised instead of an established remedy in 1886. In 1943, the uh, first randomized controlled trial. The randomized controlled trial of streptomycin. This idea of randomized was introduced in 1923. However, the first randomized controlled trial of streptomycin in pulmonary tuberculosis was carried out in 1946 by MRC of the UK. The MRC Streptomycin in Tuberculosis Trials Committee 1946 was chaired by Sir Geoffrey Marshall and the statistician was Sir Austin Bradford Hill and Philip Hart. Thank you.